When taking Ultra CoQ10, it's important to follow the directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. If you're using a liquid or powder form, be sure to measure your dose carefully using a medication measuring device or spoon. Avoid using a household spoon, as it may not provide the correct dose. If the liquid form is a suspension, make sure to shake the bottle well before measuring each dose. If your liquid comes in a tube or ampule, take the dose immediately after opening and discard any leftover liquid. Follow the manufacturer's directions for mixing the powder form. For chewable tablets or wafers, chew each dose thoroughly before swallowing. If you have a tablet that is meant to dissolve in the mouth, place the dose on your tongue and allow it to dissolve completely before swallowing with saliva or water. It's important not to crush or chew extended-release tablets, as this can release all of the drug at once, increasing the risk of side effects. Also, do not split the tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help immediately. Side effects of Ultra CoQ10 are usually very minimal, such as nausea, loss of appetite, upset stomach, or diarrhea, which rarely occur. If any of these effects persist or worsen, it's important to consult your doctor. Although it's rare, a very serious allergic reaction to Ultra CoQ10 may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's essential to note that the list of possible side effects is not exhaustive. If you notice any other effects not mentioned, it's advisable to contact your doctor or pharmacist. As for the daily dosage, it's recommended to follow the instructions on the product label or as directed by your doctor. Ultra CoQ10 can typically be taken with or without food, but it's best to take it at the same time each day for consistency. And if you have any concerns or questions about the side effects or usage, don't hesitate to consult a healthcare professional. Before starting Ultra CoQ10, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have diabetes or heart disease, make sure to consult your healthcare provider before using Ultra CoQ10. Different forms of Ultra CoQ10, such as liquid, chewable tablets, or dissolving forms, may contain sugar, alcohol, or aspartame. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances, it's important to talk to your doctor or pharmacist before using this product. If you're pregnant, only use Ultra CoQ10 if it's clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using Ultra CoQ10 if you're breastfeeding. As always, it's crucial to follow the recommended daily dosage and consult with your healthcare provider about the best timing to take this product. When taking Ultra CoQ10, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some drugs that may interact with Ultra CoQ10 include those for high blood pressure, blood thinners such as warfarin, drugs for diabetes, and drugs for high cholesterol such as atorvastatin and levastatin. Be sure to consult with your healthcare provider before incorporating Ultra CoQ10 into your regimen. As always, it's important to follow your doctor's recommendations and directions for use. If you suspect an overdose and the person has severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, you can contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Remember, it's crucial to seek help as soon as possible in case of an overdose. Make sure to attend all your medical and laboratory appointments. It is important to keep track of your health and make sure everything is in check. This will help monitor the effectiveness of Ultra CoQ10 and ensure that you are getting the most out of its benefits. If you forget to take Ultra CoQ10 at your regular time, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at your usual time. Don't take extra to make up for the missed dose. When it comes to storing Ultra CoQ10, it's important to refer to the storage information on the package. If it's in liquid form, make sure to protect it from light. If you have any questions about how to store it, don't hesitate to ask your pharmacist. And remember to keep all medications and herbal products out of reach of children and pets. When it comes to getting rid of expired or no longer needed Ultra CoQ10, it's important to do so properly. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.